It seems like you're asking for more detailed information about the risks and prevention measures surrounding cousin marriages. I'll break it down thoroughly. First, let's talk about the genetic risks of marrying cousins. Marrying cousins, especially first cousins, can increase the likelihood of genetic disorders in offspring due to the shared genetic material between the couple. Humans inherit half of their genetic material from each parent, and if both parents carry a recessive gene for a specific genetic condition, the child has a higher chance of inheriting 2 copies of that gene, leading to the manifestation of the condition. Key factors affecting the risk include the degree of relatedness and inherited conditions in the family. The closer the relationship, such as first cousins or second cousins, the higher the risk. First cousins share about 12.5% of their genes, while second cousins share 3.125%. If both families have a history of inherited genetic disorders, the risk increases significantly. For first cousins, the risk of birth defects or genetic disorders is slightly higher than in the general population. However, it's important to note that even with first cousin marriages, the overall risk is still relatively low. Some studies suggest a risk of 4 to 7% for first cousins, compared to about 2 to 3% in the general population. Types of genetic risks include autosomal recessive disorders and increased chances of birth defects. Autosomal recessive disorders are conditions where a person needs to inherit 2 copies of a faulty gene, one from each parent, to be affected. Common examples include cystic fibrosis and sickle cell anemia. Studies suggest a slight increase in the risk of congenital disabilities, such as heart defects, cleft palate, or neural tube defects, in children of cousin marriages. Cultural and legal perspectives on cousin marriages vary around the world. In many parts of the Middle East, South Asia, and North Africa, cousin marriages are common and culturally encouraged. It is often seen as a way to preserve family wealth, maintain strong family ties, or ensure that property stays within the family. Some cultures believe that marrying cousins can strengthen family bonds and maintain tradition, particularly in rural or close-knit communities. In some countries, such as the United States, cousin marriages are legal in some states but banned in others. The laws often vary based on concerns about the potential health risks to offspring, as well as religious or social beliefs. In many European countries, cousin marriages are also legal, though the cultural acceptance can vary greatly. In the UK, for example, cousin marriage is legal, but it may be viewed as controversial or less common. Islam. In many Muslim-majority countries, cousin marriages are permitted, and in some regions they are quite common. Christianity. The views on cousin marriage in Christianity vary by denomination and region. The Catholic Church, for example, has historically allowed cousin marriages. Judaism. In Jewish law, cousin marriages are generally allowed, but there is some variation in different Jewish communities. Couples who are closely related, such as cousins, can take steps to reduce the risk of genetic disorders in their children. Here are some options. Genetic counseling. Pre-marriage genetic counseling. This is one of the most proactive steps. Genetic counselors can assess both partners' family histories and offer guidance on the potential genetic risks. They may recommend genetic testing to determine whether either or both partners are carriers of any recessive genetic conditions. Carrier screening. In genetic counseling, couples can undergo carrier screening to check whether they carry genes for specific recessive genetic conditions. If both partners are carriers of the same condition, the risk to offspring increases. In such cases, other reproductive options can be discussed. Prenatal screening and testing. Chorionic villus sampling, or CVS. This test can be done as early as 10 to 12 weeks of pregnancy to detect genetic disorders. Amniocentesis. This procedure, usually performed around 15 to 20 weeks of pregnancy, can also detect genetic disorders in the fetus. Non-invasive prenatal testing, or NIPT. This blood test can detect certain genetic conditions without the risk of miscarriage associated with CVS or amniocentesis. It's used to test for conditions like Down syndrome, trisomy 18, and trisomy 13. In vitro fertilization with genetic testing. For couples with known genetic risks, IVF combined with pre-implantation genetic diagnosis, or PGD, can be used. In PGD, embryos are tested for genetic conditions before implantation, allowing couples to choose embryos without harmful genetic conditions. This approach is particularly useful if both partners are carriers of the same recessive condition. Marrying more distant relatives, such as second cousins or beyond, can lower the genetic risks associated with cousin marriage. The closer the genetic relationship between two individuals, the higher the chances of inheriting the same genetic conditions. Therefore, second cousins, for example, share only about 3.125% of their genes, which significantly reduces the likelihood of genetic issues compared to first cousins. If you mentioned Rick as a person in the context of cousin marriages and preventing genetic risks, here's a detailed scenario for better understanding. Let's assume Rick is considering marrying his first cousin. Before deciding to marry, Rick and his cousin may undergo genetic counseling to determine if they are carriers of any recessive genetic disorders. Their family histories are examined to check for conditions such as cystic fibrosis or sickle cell anemia, which might be common in both families. If they find that they are carriers of a particular condition, they may choose to pursue prenatal screening if they decide to have children. Alternatively, they could consider IVF with PGD to ensure they don't pass on these conditions. Even with these precautions, Rick and his cousin may choose to marry because the risk of having a child with a genetic disorder is still relatively low. However, the steps taken, genetic counseling, screening, and possibly IVF, help mitigate that risk. Cousin marriages are not inherently harmful, but the genetic risks do increase slightly, especially for first cousins. Preventive measures like genetic counseling, prenatal screenings, and IVF with genetic testing can help reduce the chances of genetic disorders in children. These decisions should always be made with careful consideration of the cultural, legal, and health implications, as well as the availability of medical options.